Hello and welcome to this year's Red Shawl Gala. This year marks our golden anniversary for providing 50 years of healthcare services to our urban Indian community in the Greater Milwaukee Area. In the past 50 years, the health center has grown tremendously and has been guided by a very important and distinct mission to improve the health, peace, and well-being of urban Indians in Greater Milwaukee Area. While the clinic was initially established as the Milwaukee Indian Health Board in 1972 and renamed after the founder, our mission is alive and well to this day and for generations to come. Thank you for celebrating this momentous occasion and supporting our historic journey with us.
In 1972, I had just finished my residency training at Milwaukee County General Hospital. Within the year, I was approached from the Indian community to attend a meeting. The issue at hand was the poor health status of Indian people in the city of Milwaukee. We all agreed there were serious health problems, but no real means of making any meaningful change to these conditions. We did come to the realization we could not do as individuals, but could accomplish in a unified community effort. The initial members of this group included Dr. Sheldon Schicks and Marion Muscovich, leaders of the community such as my wife, Georgiana. It also included strong supporters with deep commitments to improving health status of the Indian community. We came to realize that the Indian community was not utilizing the existing healthcare system. Health problems were not being addressed until late in the stages of disease. The health system was not sensitive nor responsive to the cultural beliefs of Indian people. Our mission was to develop an Indian health care program governed by an Indian board that would provide high-quality health care in a first-rate professional environment in a culturally sensitive manner. And in doing so, honoring and respecting the patient's mind, body, and spirit. Our aim was to install a sense of pride for Indian patients, receiving high-quality care conducive to continuity rather than piecemeal. We began with nothing and developed the Milwaukee Indian Health Board with a comprehensive health care program for Indian people. In 1980, the Milwaukee Indian Health Clinic was designated a model urban Indian health clinic, a national recognition by the Indian Health Service. What grew out of these initial efforts was a belief that what we were about to do was essential to the health of our Indian community. We all felt a sense of duty. And now Lyle has brought his exceptional skills, training, and experience to the Milwaukee Indian community. And it is under his administrative guidance this beautiful health center has continued to 50 years of longevity. Remember always that this health center is grounded in American Indian values of honoring family and community by respecting the diversity of human experience and approaching health care in a holistic manner.
I have dedicated my entire career to Indian health and have held various positions at all levels, as a frontline provider for Navajo Nation for 10 years to leading a national effort to establishing patient-centered medical home models within the Indian Health Service. When I arrived at GLIIHC in 2013, I was excited to implement a comprehensive medical model that would address and improve the health needs for the Native community of the Greater Milwaukee Area. The strategic vision at that time was to build on the foundation that already existed, expand and improve the quality and access to care, strengthen our community partnerships, integrate national healthcare reform to users of the center, promote an effective management team, and ensure our financial stability into the future. We take great pride in offering services all under one roof. Over the years, we added medical services including OBGYN, additional pediatrics, adolescent, and adult medicine, ensuring that we expand our behavioral health department from 2 to 8 providers, establishing new services such as dental, pharmacy, and physical therapy. One of our major milestones included becoming co-owners of a 32,000 square foot facility. The historic Goldman's building was vacant, available, and would fulfill the agency's need with an ideal location. This iconic Southside building was 100 years old and needed a lot of work. I remember the tours of the building with our stakeholders, I knew people were looking around and thinking, are you sure? This place looks dirty, dingy, and old. Yes, it was all that. But you had to look past that because I saw opportunity, I saw community, I saw a gem that needed to be polished as a new home for our clinic. Saying that we have a comprehensive, culturally responsive, patient-centered medical home model is one thing. Being able to be recognized locally, regionally, and nationally was another. With a new facility, new staffing, programming, and cultural services. To be recognized as a patient-centered medical home, we needed to turn over all our policies, revamp our entire organization, including processes administratively, as well as all clinical services. Within 18 months, we were able to achieve our first certification by GLIIHC, followed by NCQA as a patient-centered medical home. Within the Indian Health Service, GLIIHC became the only urban Indian health center with multiple accreditations of this designation.
The All Nations Wellness Center is home to the array of culturally integrated prevention and community-based programs that make Ignace Indian Health Center a holistic gathering place. The medicine wheel guides our approach to health and wellness and is the foundation of all programming. I think the name All Nations is so appropriate as we are an intertribal healthcare center that provides services to our Wisconsin-based tribes and tribal members across the lower 48 states and Alaska. The Behavioral Health Program and Health Promotion Disease Prevention Program provides a vast amount of services and support for the community. Our cultural and community programming provides opportunities to strengthen connection to each other and cultural identity. Both of these programs have grown tremendously over the years to support the community on their journey toward wellness. The Native Wellness Garden, language classes, archery teachings, equine-assisted learning, and beading strengthen ties to culture and wellness. Our outreach and community events continue to grow in scope with so many of our community members helping and supporting the efforts.
I used to work with the Milwaukee Indian Health Board, which is probably the grandparent of this particular program. And that's been a long time ago, probably I would say back in the late 70s was when I came to the clinic as an employee. I stayed on for 10 years and then I went to another program. But my time here with the clinic after that has been an involvement with programs, some of the services, and participating in activities that have been going on here, like bead classes. I come to craft classes, I come to support groups. I have also been involved with educational programs that have been offered here. The diabetes program is one of those, and that program helped me to better understand what diabetes is about and how it's affecting my body and how I need to control the blood sugars in my body, and also just a general overall good exercise, good nutrition, good lifestyle all around.
I think what makes it unique is everything centers around, a lot of things center around it. The community does. The community itself depends on this clinic. I would say myself personally from what I see. So it serves the needs of the Native American community for medical, for dental, for physical therapy, for AODA, which includes mental health. So it served the clinic well, and I noticed that people that are Native American would prefer to have Native American counselors when it comes to AODA. There's a connection there, and it's so important to me that counselors should be Native American.
The future for the clinic is so bright and exciting. Believe me, there are many more projects on the way. I don't know if I should say anything, but since we're all friends, I'll tell you anyways. Don't tell anyone. But we just secured major funding to start construction for the Ignace Child and Adolescent Development Center. This will be a first-of-its-kind programming to provide comprehensive services to address developmental and behavioral challenges that greatly impact the quality of life and success for Native children and adolescents.